In the PACU, a patient with an Aldrete score of 7 requires continued monitoring. The Aldrete score assesses readiness for discharge, with 8 or higher needed for transfer. A score of 7 indicates instability, necessitating further observation to ensure patient safety. Early respiratory depression in post-anesthesia patients is best indicated by elevated transcutaneous CO2 levels. A reading of 52 mmHg suggests hypoventilation, often preceding changes in oxygen saturation or visible distress, making it a sensitive early marker. For an unconscious post-abdominal surgery patient, the left lateral recovery position is optimal. This position prevents aspiration and maintains an open airway, crucial for patients recovering from anesthesia to ensure safety and proper breathing. If a pre-op patient drinks water 2 hours before surgery, the nurse should inform the surgeon and anesthesiologist. This violation of NPO status increases aspiration risk, requiring the surgical team to decide on any necessary modifications. Post-appendectomy, a patient with tachycardia and hypotension should prompt immediate provider notification. These signs may indicate hypovolemia or internal bleeding, necessitating urgent assessment to prevent complications. Early ambulation is key in preventing postoperative pneumonia. It enhances lung expansion, promotes secretion clearance, and reduces pneumonia risk, especially after abdominal surgeries, by encouraging patient mobility and respiratory function. Ondansetron is the most appropriate medication for postoperative nausea. As a selective serotonin 5-HT3 receptor antagonist, it effectively prevents and treats nausea and vomiting, particularly in the postoperative setting. Compression stockings are applied to surgical patients to prevent deep vein thrombosis. They enhance venous return and reduce venous stasis, significantly lowering the risk of DVT and pulmonary embolism, crucial for postoperative care. Passage of flatus is a reliable indicator of readiness to advance a patient's diet postoperatively. It signifies returning bowel function, ensuring the safe progression of diet and reducing the risk of complications. For a surgical wound with signs of infection, obtaining a wound culture is the initial action. This step identifies the causative organism, ensuring appropriate antibiotic treatment and effective infection management. Incentive spirometry is crucial for post-op patients with decreased breath sounds. It encourages deep breathing, re-expands alveoli, and reduces the risk of atelectasis or pneumonia, promoting optimal respiratory recovery. A urine output of 25 ml/hr post-op requires immediate provider notification. This low output may indicate hypovolemia or renal impairment, necessitating prompt reporting to prevent further complications. Coughing and deep breathing post-abdominal surgery are vital to prevent atelectasis and pneumonia. These actions mobilize secretions and promote lung expansion, reducing the risk of respiratory complications. For a confused post-op patient in PACU, reorienting and assessing airway and oxygenation is the priority. Altered mental status can result from hypoxia, making airway patency and oxygenation critical for patient safety. The lateral recovery position is most appropriate for semi-conscious patients post-abdominal surgery. It maintains an open airway and reduces aspiration risk, ensuring patient safety during recovery. A 75-year-old undergoing femur repair is at highest risk for post-operative hypothermia. Elderly patients, especially in major orthopedic surgeries, face increased risk due to impaired thermoregulation and prolonged operative time. For a somnolent post-op patient with stable vitals, assessing airway and consciousness is the priority. This ensures the patient can maintain their airway and respond to stimuli critical for post-anesthesia care. When a patient reports no pain post-thoracotomy, asking if culture affects pain expression is key. Cultural beliefs can influence pain expression, and understanding this promotes culturally competent and individualized care. Upon receiving a patient from PACU, taking a full set of vital signs is the nurse's priority. Vital signs assess physiologic stability, providing a baseline before other assessments or interventions. For a postoperative patient with hypertension reporting headache and blurred vision, assessing blood pressure and notifying the provider is crucial. These symptoms suggest a hypertensive crisis, requiring immediate attention to prevent complications.